our lecture about the birth trauma. It's important to estimate the birth trauma in a newborn, and it's divided for avoidable and non-avoidable injury to the fetus during the birth. The birth trauma, of course, as we say, may be so easy or avoidable birth trauma. The most important birth trauma is caput succedaneum. It's a diffuse edematous, often dark swelling of the soft tissue of the scalp that's extending across the midline and suture line, and seen after prolonged labor in a full term and premature. So, caput succedaneum is a condition that occurs in case of difficult labor. In this case, this is a caput succedaneum. It's a edematous changes, of course, of the scalp due to difficult labor, of course, occur in both preterm and term baby. كيف الهيماتوما? Of course, occur in the same condition due to difficult labor, and it's a subperiosteal hemorrhage that does not cross the suture line and may be associated with skull fractures. With time, may organize and calcified. This organization or calcification may reduce and start to be more smaller with time, but in certain part in classification, the lesion may stay for a long time, but in most of cases, it's resolved with time. Kyphohematoma may be associated with jaundice, while caput succedaneum never to be associated with jaundice because there is no blood to be collected inside the subperiosteal hemorrhage. Both caput and kyphohematoma not treatment because it is a self-limited condition, self-limited conditions. Of course, as we talked in the last lecture, retinal and subconjunctival hemorrhage, of course, may associate with this difficult labor and, of course, not need treatment. So common to see this presentation in the newborn that should be reassure the parents' self-limiting problem. Brachial plexus damage. Brachial plexus may result from excessive traction of the neck, producing paresis or complete paralysis. The simplest one, Erb's Duchenne palsy, of course, that involves the 5th and 6th cervical nerves. The usual picture is painless adduction with internal rotation of the arm, and the most important in a clinical point, absence of the motor reflex on the affected side, The most important in this part of palsy is to assess the hand grasp. Hand grasp, of course, intact in case of the Erb's Duchenne palsy. And this is a good prognostic sign. Good prognostic sign. Clumpic paralysis is caused also by injury to the brachial plexus that involve the 7th and 8th beside first thoracic nerve. This associated with absence of the grasp reflex, absence of the grasp reflex. This is so important for differentiation of both herpes and clumpic pulses. Clumpic grasp reflex will be lost while preserved in case of herpes. If the sympathetic nerve are injured, the ipsilateral Horner syndrome, of course, may present. Horner syndrome, of course, present with ptosis or meiosis. Both of them involve the eyelids and pupil. Eyelid to be dropped, ptosis, and size of the pupil start to be constricted, meiosis. So, clumpic pulses, of course, the prognosis may be not so good in comparison to the herpes palsy. Treatment of brachial injury is supportive and includes positioning to the affected side. Of course, this positioning to create a less traction on the affected brachial plexus. Active and passive exercise may be needed, and the nerve graft, of course, may be needed in difficult or in cases that not respond to the supportive treatment. And of course, this is nearly to be needed. Here, the picture of the brachial plexus injury. Here we say absence of the molar reflex, adducted with internal rotation, that we a waiter hand. The waiter hand, it means the person that waiting for something that taken from behind, the waiter hand. This is the adduction with internal rotation. Here we can assess the grasp reflex. We can assess the grasp reflex. Next, injury, facial nerve may be the result of the compression of the 7th cranial nerve between the facial bone and the mother pelvic bone, or by the physician forceps. If the lesion is peripheral, it's characterized by asymmetric cry deviated of the facial expression to one side, and the affected side is flat. The eye does not close normally. Besides, the nasolabial fold is absent, of course, of the side of the mouth as we dropped at rest. If there is a central injury to the facial nerve, only the lower 2/3 of the face are involved, and the forehead preserved. So, central injury to the cranial nerve, just the lower part of the face involved. Why? Because we have contralateral innervation from the other side, So the forehead starts to be preserved. This is This is the picture of the facial palsy. This is difficult to close the eyes, flattening of the labionasal folds, deviation of the mouth to one side. Of course, in this picture, the defect in this picture or the affected picture, which side? Of course, this is the normal side, and this is the abnormal side. The normal side will pull the other side toward the normal side. So here we have a right side, we have a left side facial palsy. This is completely normal. This is the completely abnormal. Other lesion that may happen during birth, skull fractures. Skull fractures are rare and usually linear and require no treatment. Just observe the newborn for a rare complication like leptomeningeal cyst. Skull fracture may be depressed, and this sometimes may need elevations, but totally speaking, it's rare and self-limited, not need treatment. Fractures of the clavicle, consider the most common fracture of the skeleton during labor and usually unilateral on its course. Of course, the macrosomic infant more susceptible for such problem after shoulder dystocia. Important to note the decrease the movement and absence of the motor reflex on the affected side. Generally speaking, prognosis is excellent and most of cases not need surgical intervention. Just follow the condition and the healing of the fracture with calc formation, of course, in certain undiagnosed cases. The newborn may present later on with mass at the site of clavicle fractures, and most of cases may be passed unnoticed unless taken X-ray by the physician for another presentation. This is a fracture on the left side. This is displaced fracture. Of course, as we say, it's a no need surgical intervention, just to positioning of the affected side and to be followed for a certain period. Extremities fractures are less common than clavicle and involve humerus more than the femur. Treatment of extremities involve immobilization and triangular splitting bandage for the humerus and traction suspension for the legs or femur fractures. Of course, these fractures may be discovered due to the irritability or continuous cry of the newborn, or so obvious swelling that noticed by the parent and by the pediatricians. Visceral trauma, so important to be noticed. The liver and spleen and adrenal gland, of course, most to be involved in macrosomic infant. Of course, this may be happening in extremely premature infant in breech deliveries. Rupture of the liver with subcapsular hematoma may lead to acute severe anemia and shock beside DIC. So, newborn that presented with striking pallor and anemia with abdominal mass should raise the suspicion of acute terminal hemorrhage that may involve the liver, spleen, or the adrenal gland. Intraventricular hemorrhage, of course, may be suspected in case of acute severe anemia and pallor with repeated fits with tense fontanelle. Ultrasound can help, or even other tools of imaging studies like CT scan give us more detail regarding intraventricular hemorrhage. Classically, the adrenal gland hemorrhage may present with flank mass, jaundice, and hematuria that may present with or without shock. So, immediate intervention should be started in such visceral trauma. So, after assessment and exam, the newborn, we have certain procedures that should be done to all children before discharge. So, metabolic screen, so important to be done in advanced centers that deal with the newborn. Blood sample should be sent in every neonate for presence of congenital hypothyroidism. So important to discover congenital hypothyroidism at birth, to be treated immediately. As you know, if these cases passed unnoticed, a lot of complication that followed undiagnosed as such problem and affect, of course, the brain. Phenylketonuria should be diagnosed in neonatal screen because this condition in need for special management and feeding. In certain states in the world, screening also performed for other inborn error of metabolism like galactosemia, cystic fibrosis, sickle cell anemia, marble syrup urine disease, hemocystinuria, and histidinemia. Other actions in the delivery room after assessment and complete the neonatal examination, every newborn should receive a single dose of vitamin K in a dose of 0.5 to 1 milligram given as a preventive dose to every newborn. Of course, this dose, small dose for prevention. If we have signs and symptoms of vitamin deficiencies, of course, this dose should be more than this, up to 5 milligram per dose, and may be repeated according to the need. Prophylaxis of gonococcal ophthalmia, either by 1% of silver nitrate or by 0.5 concentration of erythromycin eye drops. So important to do such maneuver to prevent more aggressive eye infections by such microorganisms. So important part of simple operations that should be done to the male newborn: circumcision. Circumcision, of course, mandatory in certain societies, like in our localities, because of the religion aspects, of course, and sometimes done in other societies for certain problems. So circumcision has a potential medical benefit and advantage with certain disadvantage. Benefit and risk should be carefully explained to the parents. Of course, the benefit involve prevention of inflammation of the glands and prepuce, decrease the incidence of penile cancer at adulthood, of course, later on, generally reduce the urinary tract infections. Besides the risk, local infection, bleeding, and pain. As you note, the benefit, of course, more than the risk, because the risk of such simple operation so easy and, of course, transient, that can be treated easily. So the benefit, of course, more than the risk. All newborns should be vaccinated with first dose of hepatitis vaccine. And if the mother is hepatitis B surface antigen positive, should be receive a dose of hepatitis B immunoglobulin as soon as possible after birth. Hepatitis C positive mother not need to be treated. Of course, the newborn of hepatitis B positive mother not need to be treated with hepatitis immunoglobulin, just the newborn of positive mother for antigen of hepatitis B type. So important to give hepatitis B immunoglobulin to the positive mother with hepatitis surface antigen. زين العابدين.